From the Himalayas to the Indian Ocean, a vast and vibrant nation pulses with life. But beneath the surface, a silent storm is brewing. Across India, mysterious illnesses are emerging, pushing the healthcare system to its brink. Families grapple with fear and uncertainty as doctors race against time to find answers. These are not isolated incidents, they are interconnected threads in a complex tapestry of disease and vulnerability. This is India's fight against its deadliest health crises, and the stakes couldn't be higher. This is a story about survival, resilience, and the power of human spirit in the face of an invisible enemy. Stay with us, this could save lives. Deep in the heart of Maharashtra, a medical emergency is unfolding. A sudden surge of Guillain-Barré Syndrome, or GBS, has gripped the region, leaving a trail of fear and paralysis in its wake. Over 127 suspected cases have emerged, overwhelming hospitals and stretching medical resources thin. In Pune alone, 20 critically ill patients are clinging to life on ventilators, their families praying for a miracle. GBS is a rare neurological disorder that attacks the body's own immune system, causing debilitating muscle weakness and, in severe cases, complete paralysis. 2 lives have already been lost in this outbreak, a grim reminder of the disease's potential for devastation. Doctors on the front lines are working tirelessly to combat this relentless enemy. GBS is not new, explains Dr. Nikhil Jadhav, a leading neurologist at Fortis Hospital, but this outbreak's pattern suggests a common link, possibly contaminated water. Early diagnosis and rapid intervention are crucial in the fight against GBS. The sooner treatment begins, the better the chances of recovery. We are racing against time, Dr. Jadhav emphasizes, his voice filled with urgency. The government, in collaboration with the National Center for Disease Control and the National Institute of Virology, Pune, has mobilized swiftly. Efforts are underway to identify and contain the source of the outbreak, with authorities sealing leaks and replacing aging drainage lines. The government, alongside NCDC and NIV Pune, is leaving no stone unturned. Early diagnosis and rapid intervention are saving lives. In the arid landscapes of Gujarat and Rajasthan, another battle for survival is raging. This time, the enemy is a silent killer, the deadly Chandipura virus. Transmitted by sandflies, the virus primarily affects children under the age of 15. Symptoms often mimic common illnesses, making early detection challenging. By the time the true nature of the disease is revealed, it's often too late. This year alone, Chandipura has claimed the lives of 82 young souls, leaving behind a trail of shattered families and unanswered questions. With a staggering 75% fatality rate, this outbreak is the worst India has witnessed in 2 decades. This is the largest Chandipura outbreak in 20 years, warns the World Health Organization, underscoring the severity of the situation. Without effective vector control and rapid hospitalization, survival chances are slim. Adding to the challenge, there is currently no vaccine or specific cure for Chandipura virus. Treatment is primarily supportive, focusing on managing symptoms and providing critical care. In response to this growing crisis, authorities have launched massive fumigation drives to eliminate sandfly breeding grounds. Public awareness campaigns are in full swing, educating communities about the importance of early symptom detection and seeking immediate medical attention. Zika virus. You might have heard the name whispered in the news, a distant threat, often overshadowed by other global health crises. But here in India, it's a growing danger, casting a shadow over expectant mothers and their unborn children. The fear is palpable, and the stakes are incredibly high. Maharashtra finds itself at the epicenter of this outbreak, with communities grappling to understand and combat this invisible enemy. 140 confirmed cases, a number that sends chills down your spine. Each case represents a family in distress, a community on edge, and even more concerning, 63 of those infected are pregnant women. The anxiety among these women is overwhelming, as they worry about the health of their unborn children. We know that Zika can have devastating consequences for developing fetuses. The potential for severe birth defects looms large over every expectant mother. Microcephaly, a condition where babies are born with abnormally small heads and potential developmental issues, is a heartbreaking reality linked to this virus. The impact on families is profound and long-lasting. The World Health Organization has issued a stark warning, emphasizing the critical need for mosquito control and public awareness to combat this silent threat. Their message is clear. We must act now. Every effort must be made to protect the most vulnerable among us. From healthcare workers to community volunteers, everyone has a role to play in this fight. The situation is serious, no doubt, but amidst the concern, there is a flicker of hope. India is responding proactively, implementing measures to curb the spread and protect its citizens. Across Maharashtra, teams are being deployed to carry out extensive mosquito fogging operations. They are going street by street, home by home, working to eliminate the breeding grounds for the Aedes mosquito, the primary carrier of the Zika virus. But this fight is not just about insecticides and fog. It's about empowering individuals with knowledge. Public awareness campaigns are in full swing, educating communities about Zika transmission symptoms and preventative measures. Every pregnant woman informed about the risks. Every family taking steps to eliminate mosquito breeding grounds in and around their homes. These are small victories that add up in the fight against Zika. As a neurosurgeon, I've seen firsthand the devastating effects of neurological diseases. But some of the most pressing health threats we face today stem from something far more ubiquitous. Mosquitoes. Dengue fever, a viral infection transmitted by these tiny insects, is exploding across India. This year alone we're expecting over 250,000 cases, a staggering number that underscores the urgency of this growing crisis. The link between climate change and the spread of dengue is undeniable. Rising temperatures and erratic rainfall create ideal breeding grounds for mosquitoes, allowing them to multiply and spread the virus with alarming efficiency. This isn't just a matter of uncomfortable symptoms. Dengue can lead to severe complications like internal bleeding and organ failure, pushing already strained healthcare systems to their limits. But amidst this crisis, a glimmer of hope emerges. Scientists and researchers across India are fighting back, armed with cutting-edge technology and a deep commitment to public health. One of the most promising weapons in our arsenal is artificial intelligence. AI-powered early warning systems are being developed and deployed across the country, capable of predicting dengue outbreaks with remarkable accuracy. These systems analyze vast amounts of data, from weather patterns and mosquito breeding sites to population density and previous outbreak data, to identify high-risk areas even before the first cases emerge. This early warning gives authorities a crucial head start, allowing them to mobilize resources, implement preventative measures like mosquito control, and prepare hospitals for potential surges in dengue patients. Tuberculosis. It's a disease that has plagued humanity for centuries, causing untold suffering and loss of life, and despite significant progress, it continues to cast a long shadow over global health, affecting millions each year, particularly in India. While India has made commendable strides in reducing TB cases, the battle is far from over. The nation still bears a disproportionate burden, accounting for over a quarter of the world's cases. This is a staggering statistic that cannot be ignored. This stark reality underscores the immense challenge we face in achieving the ambitious goal of eliminating TB by 2025. The fight against TB is a complex one, requiring a multi-pronged approach that involves various stakeholders. It requires not only effective treatment, but also a robust public health infrastructure. Widespread awareness campaigns are crucial, as is a commitment to addressing the social determinants of health. These determinants fuel the spread of this deadly disease. Poverty, malnutrition, and overcrowded living conditions create fertile ground for TB to thrive, highlighting the intricate link between socio-economic factors and health outcomes. Addressing these issues is essential for a healthier future. Only through a comprehensive and sustained effort can we hope to overcome this persistent threat. But even in the face of such daunting challenges, there is hope. India is at the forefront of the global fight against TB, spearheading innovative initiatives and harnessing the power of technology to combat this ancient foe. The TB Mukt Bharat campaign, a national movement aimed at making India TB-free, exemplifies this commitment. Through a combination of early diagnosis, effective treatment, and community engagement, this ambitious program is making significant strides. Moreover, the integration of artificial intelligence into TB control programs is proving to be a game changer. AI-driven tools are being used to enhance diagnosis, predict treatment outcomes, and ensure patients receive the care they need. By leveraging technology, empowering communities, and strengthening healthcare systems, India is demonstrating its unwavering dedication to conquering TB and creating a healthier future for all its citizens. From the bustling streets of Mumbai, where life never seems to slow down, to the remote villages of Rajasthan, where traditions run deep and communities are tightly knit, India faces a complex tapestry of health challenges. But amidst these outbreaks and health crises, amidst the struggles and setbacks that test our resolve, there lies an enduring spirit of resilience, a determination to overcome, innovation, and compassion. Across the country, doctors, nurses, scientists, and community health workers are working tirelessly, day and night, driven by a shared mission to protect and improve the health of the nation. Their dedication, their unwavering commitment to saving lives, and their relentless pursuit of better health outcomes is a testament to the power of human spirit and the strength of our communities. These outbreaks serve as a stark reminder of the interconnectedness of our world, the impact of climate change on our health, and the urgent need to address environmental issues and the importance of investing in robust public health infrastructure. Building hospitals, training healthcare workers, they also underscore the power of knowledge, awareness, and collective action. Stay informed, stay engaged. Together we can build a healthier, more resilient India for generations to come. Share this video, spread awareness. Let's fight these outbreaks together.